US-style question, shock and DIC by gram-negative bacteria. Question. A 45-year-old man presents to the emergency department with fever, hypotension, and rapidly progressing shock. He has a history of diabetes mellitus and chronic kidney disease. On examination, his blood pressure is 80/50 mmHg, heart rate is 120 BPM, and he is cold and clammy. His laboratory findings reveal elevated D-dimer levels, prolonged PT and aPTT, and thrombocytopenia. Blood cultures are ordered and a gram-negative organism is isolated. Which of the following is most likely responsible for the patient's condition? A. Staphylococcus aureus, B. Pseudomonas aeruginosa, C. Streptococcus pneumonia, D. Klebsiella coli. Answer and explanation. Correct answer, D. Escherichia coli, gram-negative bacteria, particularly Escherichia coli, are common culprits for causing sepsis, shock, and disseminated intravascular coagulation, DIC. E. coli is one of the most frequent pathogens responsible for sepsis and can trigger a systemic inflammatory response syndrome, leading to shock and DIC, especially in patients with chronic conditions like diabetes and kidney disease. The lipopolysaccharide LPS in the outer membrane of gram-negative bacteria activates inflammatory cytokines, e.g. TNF-α, IL-1, and coagulation cascades, leading to endothelial injury, widespread clotting, DIC, and shock. Why are the other options incorrect? A. Staphylococcus aureus, incorrect. Staphylococcus aureus, a gram-positive bacterium, can also cause sepsis and shock, but it is less commonly associated with DIC in the setting of gram-negative sepsis. Staph aureus is more commonly associated with abscesses and pneumonia. B. Pseudomonas aeruginosa, incorrect. Pseudomonas aeruginosa is a gram-negative bacterium that can cause sepsis and shock, but it is more often associated with hospital-acquired infections, particularly in patients with immunocompromised conditions, e.g. cystic fibrosis, burns, and indwelling devices. E. coli is a more common cause of DIC in this case. C. Streptococcus pneumoniae, incorrect. Streptococcus pneumoniae is a gram-positive bacterium that can cause sepsis, particularly in pneumonia and meningitis, but it is less likely to cause DIC compared to gram-negative sepsis in this context. E. Klebsiella pneumonia, incorrect. Klebsiella pneumoniae is another gram-negative bacterium that can cause sepsis, but it is more frequently associated with pneumonia, abscesses, and urinary tract infections. While it can lead to sepsis and shock, E. coli is a more common cause of DIC. Key learning points. Gram-negative bacteria, such as E. coli, are associated with sepsis, shock, and DIC due to the activation of the inflammatory response and coagulation cascades. The lipopolysaccharide, LPS, in the outer membrane of gram-negative bacteria triggers widespread inflammation and endothelial injury. DIC is characterized by elevated D-dimer, thrombocytopenia, and prolonged PT-aPT. Would you like further clarification or more questions about